Good morning students. Today we are going to discuss about examination of 3, 4, 6 cranial nerves. Very important practicals. Now the question arises, why 3, 4, 6 is commonly fixed among the 12 cranial nerves? Very simple. These 3, 4, 6 cranial nerves are associated with extraocular movements or simply eyeball movements. Very, very simple. So all the movements of the eye, medial rotation, lateral rotation, upward, downward, all these are concerned with 3, 4, 6. Now I will write third nerve is oculomotor nerve. Fourth nerve is trochlear nerve. Sixth nerve is abducens nerve. Now next question, which nerve supplies which muscles? Why the main reason of making this video is, if sometimes if you ask examine the sixth cranial nerve, what students used to do? So when the question is examine the sixth cranial nerve, the student will do all the movements because 3, 4, 6 are put together as a set. Please remember, sixth nerve supplies only one muscle. That's what I am going to tell. Fourth nerve supplies only one muscle. Third nerve supplies the remaining muscles, which I will explain. Please note down, the mnemonic is SO4 LR6. Fourth nerve supplies superior oblique muscle. Sixth nerve supplies lateral rectus muscle. Third nerve supplies all other eye muscles. Write down the mnemonic SO4 LR6. After finishing fourth, sixth, I will go for third nerve because fourth nerve is supplying only superior oblique, so that I will be able to explain. Sixth nerve supplies lateral rectus. Please just concentrate this diagram. Right eye, left eye, nose. So medial. Move the eyeball moving towards the medial side is medial rectus. Moving lateral. Eyeball moving lateral is lateral rectus. Just concentrate, very, very important. Yeah, this is lateral rectus for left eye. Eyeball moving this side is lateral rectus of right eye. This is superior rectus. This is inferior rectus. Note it down. For oblique, always inferior oblique is upward movement. Superior oblique is downward movement. Please note it down. For oblique, superior oblique is down, not up. Inferior is up. For oblique alone, it is reverse. Now I will call the subject. Yeah, this is our Mr. Ranjit. You might have seen him in Rinne's test, Weber's test video also. So as usual, now we are going to examine the subject. First, get the permission from the subject. Make him comfortable. Tell him what you are going to do. Now, today we are going to do the movements of the eyeball. Yeah, now I asked, examine the sixth cranial nerve. The sixth cranial nerve is what? You can pause the video and answer. Abducens nerve. Abducens nerve supplies lateral rectus. See the diagram? Lateral rectus. So for this eye, if I want to check lateral rectus muscle, what should I do? Just to concentrate. So you can clearly see, for this eye it is lateral rectus. For that eye it is medial rectus. The eyeball is coming towards the nose. This eyeball is going away from the nose. Just concentrate. Just I am doing, I can use this pen. Yeah, this eyeball is moving laterally, that eyeball is moving medial. So this is lateral rectus muscle, that is medial rectus muscle. So lateral rectus is supplied by, already I told you, abducens nerve. Medial rectus is supplied by, I have not yet told, but you can try to answer. Please note it down, SO4 LR6. All the remaining muscles are supplied by third nerve. I have written here. Yeah, third nerve supplies medial rectus, superior rectus, inferior rectus, inferior oblique. Remaining muscles, apart from superior oblique and lateral rectus, all other muscles are supplied by third nerve, which is oculomotor nerve. And note it down, levator palpebrae superioris. That is also a muscle which causes upward movement of eyelids. Now if I ask, examine the fourth nerve. So you see this diagram, I have made it clear. Eyeball moving lateral side, upwards is superior rectus. Eyeball moving lateral, downwards is inferior rectus. Eyeball moving medial, upwards is inferior oblique. Yeah, now just concentrate on one eye. You tell which muscle? Yeah, lateral rectus. Yeah, lateral and going upwards. Lateral and going upwards. Yeah, now his superior rectus is acting. Superior rectus is supplied by what nerve? Third nerve. Lateral rectus, sixth nerve. Superior rectus, third nerve. Lateral rectus, inferior rectus. So lateral here. So I am doing that experiment. Lateral and downwards, inferior rectus, medial rectus supplied by third nerve, medial and downwards here. Medial and downwards, superior oblique. Superior oblique is supplied by fourth nerve. Lateral rectus is supplied by sixth nerve. All others are third nerve, third nerve, third nerve. This is sixth nerve. If the examiner asks, test the inferior rectus muscle. So what I should do? Lateral, downwards. Superior rectus, lateral, upwards. Very simple. So overall it is very easy. Just I can do medial rectus. I will just tell the muscles name. Please concentrate. Medial rectus, inferior oblique, superior oblique. Lateral rectus, superior rectus, inferior rectus. Simple. No? But again there is a confusion. In anatomy, usually they will tell superior rectus for intorsion. Sir, you are telling superior rectus lateral and above, but superior rectus comes for intorsion, sir. Note it down, please. Intorsion. Remember the word sin. S-I-N. In for intorsion, S for superior rectus, superior oblique. I have written here. Please note it down. Please remember, intorsion is the inward movement of the eyeball. I will not be able to exactly show what happens is superior rectus and the eyeball tries to move inwards like this. Yeah, this is superior rectus and the superior oblique is this one. Just to concentrate, it is like superior rectus and trying to go like this. Intorsion, inward movement of the eyeball. Sin, IN is intorsion. This is superior rectus and it inward movement of the eyeball, superior oblique. So yes, sin, yes, sin. Note it down. Intorsion. If they ask, intorsion of the eyeball is done by what? It is superior rectus muscle and superior oblique muscle. Extorsion of the eyeball is inferior. Inferior rectus and inferior oblique. You can see here. Extorsion is this one. Yeah, it will be going like this, inferior oblique and coming like this. Extorsion. You need not confuse, just remember. Intorsion is superior rectus and the superior oblique. Extorsion is inferior oblique and inferior rectus. Remember like that. One more muscle we have left. What muscle? Yeah, levator palpebrae superioris. So now we need not do any test to check the levator palpebrae superioris. Just you will be able to elevate the eyeballs normally. Yeah, so he is able to elevate. Now tell me the muscles supplied by the third nerve. You can very easily tell. Except SO4 LR6, all the muscles are supplied by third nerve. Very easy. So now, if his levator palpebrae superioris muscle is affected, LPS, levator palpebrae superioris is affected, what will happen? There will be drooping of eyelids. Note it down. When the levator palpebrae superioris, for example, if the third nerve is affected, there is possibility of he will be suffering from drooping. So when you are doing third nerve, so you should ask the history of any drooping of eyelid. So for him, Mr. Ranjit, third nerve is normal, so no drooping of eyelid. And again, as I mentioned, all the movements, for example, this is normal, this is normal, this is normal, this is normal, this is normal. So all the eye movements are normal. All because of that, the eyeball is fixed in the center. This side eyeball is being pulled, this side eyeball is being pulled. So all angles eyeball is being pulled and it is fixed at one position. In case if any one of the nerve is paralyzed, either third or fourth or sixth, what happens? The eyeball may not be fixed. That is called squint. For example, for him you can see eyeball is in center, the eyeball is in center. In some patients, even without me doing, normally itself the eyeball will be like this. See, for him the eyeball is moved medially because I am making the medial rectus work. I am asking him to see my finger. But even the center, this eyeball will be moving in the middle. That is called squint. So squint, for him no squint, note it down. In case if some muscle is not functioning, what will happen and ask him to do? Yeah, there will be involuntary movements of the eyeball. That is called nystagmus. So for him, no drooping, no squint, no nystagmus. So all those things you should tell when you are doing 3, 4, 6 cranial nerves. And another important thing, when I am going to do, I have to ask one important question. Please note it down. Now, so what I asked is whether he is able to see double vision. So no double vision. That also I can write. So in general, 3, 4, 6 means movements of the eyeball. That we know. But apart from that, all these you should ask. And levator palpebrae superioris is supplied by third nerve. Apart from superior oblique and SO4 LR6. Please fix it in mind. Apart from that, all the muscles are supplied by third nerve. Very easy. And now, If the question is movements of the eyeball, I can stop with this because I examined all the movements of the eyeball. But the question is examine the third, fourth, sixth cranial nerve. Then third nerve, remember, it is a mixed nerve. It is not purely motor. Fourth nerve is purely motor. Note it down. It just fourth nerve just supplies superior oblique. Sixth nerve is purely motor. It just supplies lateral rectus. But third nerve, any idea? Some reflex. Yeah, correct. Third nerve is the efferent for light reflex. Please note it down. Third nerve also supplies sphincter pupillae. Sphincter pupillae muscle causes constriction of pupil. So constriction of pupil takes place in which reflex? Light reflex. So when they are asking you to examine the third nerve, apart from the movements of the eyeball, the muscles which is supplied by third nerve, I have to do light reflex. Always we should not directly make the light fall on the eyeball. That will chance of damaging the cornea. So it will come from sides always. So this is direct light reflex, and what I will see, I can even close like this. Yeah, I will be able to see the constriction of pupil. Why constriction of pupil? The pupillary muscle is constricting. So when light strikes the pupil constricts. That is light reflex. So for light reflex, afferent is second nerve, efferent is third nerve. Since here we are doing examining the third nerve, I have to do light reflex. Yeah. So when the light falls on the pupil, there is constriction of pupil. You can clearly see. Yeah, yes, you can see the constriction of the pupil. This is direct light reflex. Indirect light reflex also you have to check for third nerve. Indirect light reflex is when the light falls on the right eye, right pupil constricts, no doubt in that. But at the same time, left pupil also constricts. I can see here it. Yeah, I am able to see. When light falls on the right eye, left eye also constricts, but I have to see that. I have to keep a book or some barrier in between, because to check indirect light reflex, this light should not fall on the opposite eye, because I am checking light falling on the right eye and the pupil constricting on the opposite eye. So I have to put a block between the right and left eye for doing indirect light. So note it down. For third nerve, you have to do direct light reflex, indirect light reflex. One more reflex, which is important functioning of third nerve, is accommodation reflex. Accommodation is eyes adapt or accommodate. So what I will do is accommodation reflex. So I am asking him to see a distant object. Yeah, you can clearly see when his vision shifts from distant to near, the eyeballs converge and there will be constriction of pupil and the medial rotation of the eyeball. And the convexity of the lens is increased. So all these takes place in accommodation reflex. For third nerve, apart from the movements of the eyeball, I will do light reflex and accommodation reflex. Now I will give you an assignment. If you examine the fourth nerve question, so what I should do? They are not asking examine 3, 4, 6. They are not asking you movements of the eyeball. They are asking you examine the fourth nerve. So you know fourth nerve is trochlear nerve. Trochlear nerve supplies SO4. So superior oblique. So what I should do? Superior oblique. Superior oblique. Oblique means adduction. Rectus means abduction. Yeah, this is superior oblique. So if they ask examine the fourth nerve, only one step. That's all. Fourth nerve. Examine the sixth nerve means. That's all. I am telling for this side. Now I will do it on this side. Now the question is, examine the sixth nerve. Yeah, that's all. Lateral rotation of eyeball, lateral rectus. Lateral rectus is supplied by sixth nerve, LR6. Examine the fourth nerve means. Examine the fourth nerve. Superior oblique. Oblique means adduction. That's all. Superior oblique. Don't do all the test. If they examine the 3, 4, 6 means kaifi over. That's all. So all the movements of the eyeball involves 3, 4, 6 cranial nerve. If the question is examine the third cranial nerve, you have to do light reflex direct, light reflex indirect, accommodation reflex, and all the movements of the eyeball except lateral movement of the eyeball, which is supplied by lateral rectus. Lateral rectus is supplied by sixth nerve. So in today's video, we have discussed in detail about third nerve, fourth nerve, sixth nerve, and remember to write all those things. No drooping of eyelids. There is no squint. Nystagmus I already explained. When I am asking him to move the eyeball like this, there will be horizontal movement of eyeballs, which is called horizontal nystagmus, or vertical movement of the eyeball, which is called vertical nystagmus. For him, no nystagmus. Double vision I asked when I was doing whether he is able to have 2 times vision or double vision is there. No double vision. So all these things also have to be asked when you are doing 3, 4, 6. Hope this video was very useful for you. So for regular theory videos and practical videos, subscribe our channel Physiology Lectures by Dr. Senthil Kumar. In upcoming video, we will discuss further practicals. We are hoping to complete the CNS series. Already I have put your English test, Weber's test, so you can even watch that video. We will meet in the next video. Thank you. For those who have not subscribed our channel, subscribe to our channel and share to our students community, medical students, paramedical students and dental students community. It will be definitely useful for you. Meet you in the next video. Thank you.